there, and welcome to the second episode of Mentality. In the previous video, we have discussed the effect of current pandemic situation on our mental health and strategies to deal with it. So, if you haven't seen the video yet, please do watch it, and its link is in the description box. A lot of people have misconceptions or doubt about mental health or people suffering from mental health issues. Today, we are making an attempt to clear out some of those doubts. So in this video, we will be discussing about myths and facts about mental health and mental health professionals. As we had taken a survey before starting this series, we will be taking help of those responses as well. Hope you find this video helpful, and let's get started. First, we will have a look at the current scenario of mental health in our country. In the 2019 report of World Health Organization, it revealed that 7.5% of Indian population suffers from some form of mental disorders. And they also predict that by 2020, roughly 20% of India will suffer from mental illness. Mental illness constitute 1/6 of all health-related disorders, and India accounted for nearly 15% of global mental, neurological, and substance abuse disorder burden. To cater this demographic, we have less than 4,000 mental health professionals. There is also a lack of research for mental health in our country. So encouraging researches into mental health will help to examine how people get affected by it and how it can be prevented or effectively treated. Moving forward, let us discuss some myths related to mental health. You must be thinking that, do I really have myths related to mental health? In different studies, it is observed that people possess various myths, and thus we thought it is important to discuss and reveal the corresponding facts. The first myth is, mental health problems are rare and they don't affect our life. Well, this is not true. Statistics says that 1 in 4 people experience mental health issue, which means that someone you know might be struggling with mental health issue. So as sometimes we have some physical illness or injuries that affects our daily life activities or tasks. Similarly, when we face some mental health issues or illnesses, somewhere it affects our daily life functioning. The next myth is, I can't do anything to support a person with mental health illness. The truth is, friends and loved ones can create a big difference. Very few adults, adolescents, and children with diagnosable mental health illness receive needed treatment. Friends and family can be an important influence to help someone get the treatment and services they need. There are few more things we can do, like reaching out and letting them know you are available to help, helping them access mental health services, learning and sharing the facts about mental health, especially if you hear something that isn't true, treating them with respect just as you would respect anyone else, refusing to define them by their diagnosis or using labels such as crazy. The another myth is, mental health issues are not recoverable. Most people with mental illness recover well with appropriate ongoing treatment and support. There are certain stigmas associated with mental illnesses. For example, people with depression can't just cheer up, or people suffering from anxiety can't just calm down. Like we show support to someone who is differently abled, let us also support and respect to people who are fighting against mental illness as well. Now, we will see some biases towards people suffering from mental health issues. The survey which we have conducted and the researches shows that there are still some biases towards people who are suffering from mental health issues. Like people suffering from mental health issues behave in a particular way. The research says that when people describe a person with mental illness, they assume that individuals are suffering from depression, those who feel disconnected with people, get easily distracted, clean too much, are born with a brain defect, prone to violence, etc. Due to this kinds of assumptions, there is still a stigma about them and they are addressed using words such as retarded, crazy, mad, stupid, irresponsible, or careless. Due to lack of awareness regarding psychological or mental health issues, there are some misconceptions that individuals suffering from mental health issues are weak. Due to these conditions, they cannot work. Also, people suffering from this are violent and unpredictable and need to be isolated. But the fact is, people suffering from mental health issues are not weak. It's just they are not aware about what is hampering their daily life and why. People with mental health illness are good and punctual in work as other employees. But sometimes they have to work much harder than others, as they are going through a lot many things while working, which may mentally exhaust them. We all have to understand that as we seek medication for any physical illness or injury to avoid further consequences and for better physical health, similarly seeking help for any mental health issue when needed help us to keep ourselves mentally healthy and avoid negative consequences further in life. And so it is not a sign of weakness or inability to work. Isolation is one of the biggest obstacles for a person recovering from illness. A very small number of people with mental illness needs hospital care. Most people recover quickly with appropriate treatment. Confronting the negative attitude of discrimination and isolation just for having illness will ensure a quality of life for people with illness and a supporting recovery. Not all people suffering from mental health issues are violent or unpredictable. In fact, it is just one of the symptoms of issue, which has a solution in psychological treatment. We all need to understand that labeling on the basis of mental health issues as adjectives or saying that they cannot work or need isolation is resulting in lack of seeking help from a mental health professional. The another myth is people think only adults and teenagers seek help for issues related to mental health. No, not just teenagers or adults, but anyone, whether it's a child, adult, or an elderly, anyone can seek help for their mental health issues. Many of us also think that young people just go through ups and downs as a part of puberty and it's nothing to worry about. But the fact is, 1 in 8 young people experience mental health issue, which needs to be addressed. Also, we think that children don't experience mental health problem. But even a very young child may show early warning signs of mental health concerns. Early mental health support can help a child before this issue interfere with other developmental needs. Now the elderly, which holds the most experience in life, may also require help. It can be just for ventilation of their feelings they hold in their mind. So with all that, we should be aware of this fact that individuals of any age, gender can seek help from a mental health professional. So far, we have discussed myths related to mental health, which will help us to dissolve our misconception regarding this. As mentioned earlier, we have conducted a small survey in which we have asked participants to report what according to you mental health professionals do. Till the date, some people do believe that mental health professionals read minds or understand person's personality or nature at a gaze. But the reality is different. Mental health professionals use their observation skills and listening skills, which help them for assessment. Now we will look at some values mental health professionals follow while working with clients, which gives them a different experience and a platform of sharing. How mental health professionals work or what they do. The most important thing followed by professional, or we can say it is one of the ethics of the mental health professionals, is to maintain confidentiality, which means that whatever issue you tell to them or the conversation takes place during a session remains between two of you. That is the professional and the client. Not even a piece of information is disclosed without client's consent. When you address an issue to a professional, the severity or the importance that issue holds in your life, it is also important for the professionals. The issue, whether it is the smallest or the biggest, the way it is important for you, similarly, it is genuinely important for the professionals. Many times we have this thought in our mind while sharing any of our secrets or issues with any friends or family members, that what will they think about me when I say this thing to them? Will they see me as a bad or a stupid person after listening? After having these thoughts, we somewhere decide not to tell or tell with some masking. But you don't have to keep this thought when you share anything with the mental health professional, as they listen to you following the non-judgmental approach. They listen to you without keeping any biases, so you can freely express in front of them. We all have shared our issues at least once with some of our friends or family members, and we have received some common advices or suggestions like this is life, this is how it goes. You will not even know and it will be gone one day. The problem you are facing, it will change. And also we often hear about others' experiences they tell us. Like one of my friend had the same thing. She or he did this and it helped them. So even you do it. And many more. So we receive a lot of advices and suggestions which we did not even ask for. But when we share with a mental health professional, they don't tell us what to do or what should not be done. They don't give solutions to our problems. Rather, they help us showing the path towards it and supports to reach the desired outcome. It is called a working alliance, which means that whatever issue you are facing, you will work to resolve it with the help of the professional. Client and the mental health professional work together towards reaching the solution. Whatever steps are going to be taken, it will be taken only with the client's comfort level and mutual consent. At the end, the ultimate goal for a mental health professional is their client's well-being, and together the client and the professional works towards it during the sessions. So, in today's video, we discussed about myths and facts and what mental health professionals do. We hope that it has helped you in widening the scope of information about mental health. But what if you are the one who needs the help from mental health professional? Don't worry. In the next episode, we will be discussing about different mental health professions, their work and qualification, which will help you to understand from whom to seek help in a particular situation so far mental health is concerned. Thank you.